Hey listeners, the Health and Wealth Expo, a virtual summit, is back. This is your chance to learn, grow, and build your future from anywhere. Visit healthandwealthexpos.com today to secure your spot. Before we get started, I want to say that my content from last week really ruffled some feathers. As of January 31st, 2025, there were 67 active tuberculosis cases and 2 deaths in 2 Kansas counties. In the past, RFK Jr. has expressed concerns about vaccines. He seemed to have had a different perspective during his confirmation hearing. However, these preventable outbreaks, as NBC News just mentioned, are the reasons why we have these vaccines in place and why these vaccines are important. Welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduced stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started. Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra. And before we get started, I want to say that my content from last week really ruffled some feathers from the response that I received. I received some great responses, but some of the feedback that I received, it really speaks to who you are, and it really speaks to what you believe in. And it's okay. It's okay for you to have your values and beliefs, and it's okay for me to have my values and beliefs. And I thank you for commenting, and I thank you for sharing. And we're going to move on. I do want to say this. RFK Jr. has been confirmed. And how many people feel like that's going to just be what's the opposite of good? Now, this outbreak in Kansas, and I'm just going to read some details to you. It says, as of January 31st, 2025, there were 67 active tuberculosis cases and 2 deaths in 2 Kansas counties. It can take many months after infection for symptoms to develop. And there can also be time between the appearance of symptoms and a diagnosis. So yes, that is tuberculosis. Usually as healthcare professionals, what we do when we do what's called man-2 tests, we do PPD tests, and a lot of times nurses will get these tests done upon hire. And sometimes people who have had tuberculosis in the past, specifically when they come from other countries, they have to have chest x-rays. So that is something that we still test for, and hasn't truly had concern about an outbreak. But here we go now in Kansas. I'm interested in knowing how RFK Jr. is going to handle this, especially being the Secretary of Health and Human Services. This is where we would need him to step in. So let's see how he handles it. And NBC News just reported that, let me put my glasses on for this one. NBC News actually reported that in rural West Texas, a measles outbreak rose with no end in sight. At least 49 cases have been confirmed. Health officials who are scrambling to get a handle on the vaccine preventable outbreak suspect 200 to 300 people may have been infected. Now, why is this important? In the past, RFK Jr. has expressed concerns about vaccines. He seemed to have had a different perspective during his confirmation hearing. However, these preventable outbreaks, as NBC News just mentioned, are the reasons why we have these vaccines in place and why these vaccines are important. Because now, look, we have health officials scrambling on how to handle this vaccine preventable outbreak. When we put people in place who are not qualified to handle the position or the territory that comes along with it, these are the type of things that happen. When we take information down from like the websites that were taken down for the Center for Disease Control, doctors use those websites. Doctors for America filed a lawsuit against that information being taken away. Doctors actually use that information. So you're going to take away information that people use as resources. So what happened? A judge stepped in and ordered for the CDC and FDA to restore their web pages removed after Trump's order. So U.S. agencies told to reinstate critical public health information that had been scrubbed from public view. A federal judge has ordered that the Department of Health and Human Services, the Center for Disease Control and Prevention, and the Food and Drug Administration restore several of the web pages that they took down following Donald Trump's executive order attacking diversity, equity, and inclusion. Now, I'm being told that I can't use that word, but I can't not use that word because we know what diversity, equity, and inclusion means. And diversity, equity, inclusion is basically about giving access, right? Diversity, equity, inclusion, to put it simply for those. And I know a lot of people are saying, well, it doesn't necessarily affect me. The number one percentage of people that it affects is white women. Listen, let's be clear. I understand people like to go to statistics, which is fine. I want to point out diversity, equity, inclusion is about access. And what do I mean by that? It's about giving opportunity to the underrepresented. Diversity, equity, inclusion was created for just that. It was created to provide access and opportunities to those who are underrepresented so that they have the same options and abilities. I was listening to Adrienne Smith recently, and if you don't know who she is, she runs a nonprofit called the Can Diversity Collective. I love the example that she used, and she used the example of the lower edge curve. You have that lower edge curve that was created to provide access to those with disabilities. But not only does it provide access for those with disabilities, it also provides access to mothers who are pushing their baby strollers. It also provides access to people who have their shopping carts going into grocery stores, right? It helps and affects a lot of other people. Now, it's the same thing with diversity, equity, inclusion. Now, if you raise that curve, you're now blocking the access for people who may not have that same opportunity. Raising that curve is similar to removing DEI. So to end DEI, you're suggesting to raise the curve so that no one has access. And I think we're forgetting about that. When we look at statistics, when we talk about the representation of women in high achieving roles by let's look at race and ethnicity for a second and entry level roles. Now, 28% of white women hold entry level roles, while 19% of women of color hold entry level roles, with white men, holding 33% of those entry level roles. And then just look at the C-suite. We have 22% of white women at the C-suite level, and then we have 7% women of color at the C-suite level, while 56% of white men are at the C-suite level. And these statistics are from a report from Women in the Workplace 2024. When we look at gender pay gaps by race and ethnicity, we have all women making about 82 cents compared to white men. And then Hispanics and Latino women make about 58 cents compared to white men. And Black women make about 63 cents compared to white men. And these are statistics from the U.S. Government Accountability Office. I share these statistics with you to point out the impact of diversity, equity, and inclusion on minority access into jobs. Let's talk about improved patient care and health outcomes for a second. Diverse teams and inclusive environments can lead to better patient care and enhanced innovation. Also, DEI efforts help in connecting with diverse communities, promoting inclusivity and facilitating access to health insurance. Now, these insights really underscore and highlight the ongoing challenges and the importance of DEI initiatives and the importance of promoting equitable representation and access in both professional and healthcare settings. For healthcare professionals, if you read these statistics and you're wondering, for your nurses in particular, if you're wondering, what can I do about it? I'll share with you one thing you can do about it. This is the time to start your own business. There are so many different businesses that nurses can use. And for nurses in particular, this is the time to really start considering and investing in yourself, educating yourself, and understanding what entrepreneurship looks like, what it looks like to try to start your own business, this is the time that you want to do that. And I'll tell you why. Something that you don't want to happen, you don't want to be stuck in a place where you don't know where your next paycheck is going to come from when you have all of these skills. I sit back and I've been looking on LinkedIn and I've been seeing how a lot of people are getting laid off, and they're getting laid off because of low performance. I think I mentioned in a previous podcast that Mass General, Brigham, they have a $250 million deficit and they'll be laying off. And I share this with you because I don't want you to get caught in that. I want you to be able to, nurses should be using their expertise. Nurses should be not in a position where they don't know what to do next. So now they have to find another job, or they have to move away from their hometown so that they can find work. No, why not start your own business, work from home right where you are? And you know what? Be your own CEO, be your own CNO. There was a time where I aspired to be a CNO of an organization. And guess what? Now I'm my own CEO and CNO. And you can do it too. Listen, if I can do it, yes, I have years of experience as a nurse. Yes, I worked my way up and achieved, certifications, terminal degrees. Yes, I did all of that. You don't necessarily have to do that, right? So anyone can start a business. You don't even really have to be a healthcare professional to start a business, right? And this is why we are hosting the Health and Wealth Expo, a virtual summit on February 22nd, so that you can come and learn these things. I want you to start positioning yourself. And I've been saying this for weeks on end because I told you guys that position was my word of the month. And I want you to start positioning yourself and educating yourself and investing in yourself so that you understand and know what that means or what it looks like to have your own and not have to rely on or worry about when they're going to do layoffs or what's going to happen here. Now, some people may have the notion, well, I'm a nurse, I'm a healthcare professional, I'll always have a job. Okay, that's fine too. What How long are you going to just continue to just be comfortable and not knowing they have AI? You have RFK Jr., who is now the Secretary of Health and Human Services, and talking about AI taking on nursing roles. I just don't want you to get caught out there. And this is not to place fear among anyone. I don't want you to be afraid of anything. I want you to be confident. I want you to be empowered. I want you to take your skills and all of that education that you have and put it to great use. And one of the ways you can do that is by joining us at the Health and Wealth Expo, a virtual summit on February 22nd, 2025. You can register at healthandwealthexpos.com. And listen, we are also going to be having an in-person summit in New Jersey, May 15th and 16th. And there'll be more to come about that topic. This week is our final week. We're going in strong into the virtual summit on February 22nd. So I don't want you guys to miss out. We're going to be talking about IV hydration, how to start an IV hydration business. Look back at the previous podcast. You're not a real nurse if you don't work in a hospital. That is episode 46. So watch episode 46. You'll see a lot of the highlights from the other from the experts, I should say, that are going to be running it down for you guys, giving you guys so many gems. I am so excited about this summit. And the lineup is just absolutely amazing. And you're going to walk away with so many gems. And trust me, you're going to want more. And I want to give you more. And that next step is probably more than likely going to be that May 15th and 16th, that Health and Wealth Expo live summit that's going to be taking place in New Jersey. And tickets for that are actually available. But for right now, I want you guys to really, take the opportunity to even get your feet wet with the Health and Wealth Expo virtual summit. And this is how you start to educate yourself. This is how you start to invest in yourself. This is how you start to really learn, okay, how can I use my skills? How can I use my skills and do something that use my expertise? Because you've been trained, you went to school, you have a degree in this, you received hands-on training. So you're probably certified. You have all of the things that you need: BLS, ACLS. These are the things you have everything that you need. The next thing that you need is that confidence in yourself. So I do want you to join me at the Health and Wealth Expo virtual summit, February 22nd. You can log in and register at healthandwealthexpos.com. So this is the last week to register. For the summit, it's going to be Saturday from 11 a.m. to 4 p.m. This is your last week to register. So put the day aside. Listen, once you register, you'll receive the agenda this week and you can see, okay, I want to attend this one, this one, this one. And don't forget the All Access Pass. Now, the All Access Pass is available and you will gain access to the replays with the All Access Pass. And you will also gain access to, you'll get your Health and Wealth Playbook and you'll get access to that bonus session on funding. So I can't wait to see you there. I'm excited about Saturday. I'm so excited about it. I hope to see you guys there. And thank you so much for listening. Until next time, make sure that you guys stay inspired, stay educated, and stay empowered.